Hello friends, I'm Dr. Krishna. Today I'm going to talk to you with regard to about myths and medications. I work at Tendermines Clinic and at the River Hospital, Mysore. There are certain myths people believe about psychiatric medication. I'm just going to talk about those and I'm going to bust those myths. First one, which usually commonly people think, is all psychiatric medication cause addiction. No. Medications are designed in such a way to use on long-term basis. So people misconceive this as they are addicted to this medicine. No, they are given to compensate certain neurotransmitters so that people live a better and healthy life while taking the medication. There are other myths. Once on medication, always on medication. So that is not happens. Psychiatric medications are given on a long-term basis, not like in general. A normal doctor usually gives some antibiotics for 5 to 6 days, most probably 5 days. But usually psychiatric medications are given at least for a minimum of 6 months, and there are reasons behind that as well. Our brain takes a longer time to get adjusted to the medicines and also to become better. Your behavior doesn't change in a day. It takes around at least a month to 2 months to get a proper therapy. To get better, it may take up to 2 months or up to 3 months in certain cases. So even when you get better, we continue the medication for a few more months so that you don't relapse. The medication lasts up to 6 months. And in certain cases, if it is the problems are recurring, the doctor may go from 1 year to 3 years. And in certain cases, can go up to a decade. There are other myths like medications are dangerous. No. These medicines are very, very safe. They are made in such a way to be used for on a long-term basis. Most of the medications are generally very, very safe, so that if you are using for even for decades, you should not have any problem with that. But certain medication, like all other medication, do have certain side effect that the doctor knows, and the doctor will regularly check you, or will be doing some blood test in order to find there are no side effects with the medication. That is the usual procedure, so that you don't develop any side effects, long-term effects with the medication. Then there are certain other myths, like medication causes kidney disease, liver disease, or it can lead to heart failure. No, these are myths. Even if the patient is suffering from kidney problem, we give medications, certain psychiatric medication, but we give in a lesser dose. So we do continue in this patient. In that way, as you know, it is quite safe to use even during the failures as well, in kidney failure, liver failure, or in heart failure.